So after having children, you absolutely love your body for what it did, but sometimes you'll look in the mirror and you don't recognize it anymore. My name is Dr. Eric Barker, and I'm the plastic surgeon here at Peak Plastic Surgery Center, specializing in cosmetic breast and body surgery. So when talking about a mommy makeover surgery, many patients are confused of what actually is a mommy makeover. When it gets down to the nuts and bolts of it, a mommy makeover is a combination of a breast procedure and a body procedure. This does not mean that you had to have had a pregnancy in the past, but it is a overall generalized term of a breast and body combination procedure. So many times after childbirth or age, weight loss, weight gain, a mommy makeover could include a breast augmentation and or lift with a tummy tuck, with or without liposuction. When choosing a customized combination for each individual mom, I need to sit down and understand what is each patient's individualized goals. Not everybody's is going to be the same. Some patients would like increased size, projection, and shape of their breasts, which would have to include an implant. Some just want their breast to be in a more natural position and are not interested in an implant, which we would do a breast lift. Some patients are just looking for a little change of their abdomen or side area. Some are looking for large, so some could undergo liposuction alone. Some may need to undergo a combination of liposuction with a full abdominoplasty or tummy tuck. So I often receive the question from patients when they come in, what is a rectus diastasis following pregnancy? When we talk about that, what it is at its core is the separation of your rectus musculature group in your abdomen. This occurs when you are pregnant and your uterus expands, needing to have an expansion of the abdominal wall. So you have a thin layer of fascia separating your two muscle groups in your abdomen called the linea alba. This is the area that stretches, but when it stretches, it may not ever be able to go down to the original position because it is only fascia and does not obtain contractile units like muscle would. So if you have a diastasis rectus, which is greater than 3 to 4 centimeters, it may not ever be able to go back to its original position with diet and exercise alone. When talking about undergoing a mommy makeover surgery, many patients would like to have it done immediately. However, how long should they wait afterwards is a very important discussion to be had with each patient. Typically after pregnancy, I would like my patients to wait 9 to 12 months for any tummy tuck abdominal surgeries to ensure that their abdominal wall has had adequate time to recover, as well as the skin recovery. As far as the breasts, if you are breastfeeding following surgery, I want you to be done 4 to 6 months of breastfeeding to ensure that the glands, the ducts, and that your breast tissues have returned to their baseline level. Many patients come in with a concern of, is it safe to undergo a breast and body surgery in combination? The answer to this is unequivocally yes. However, you need to ensure that the patient is safe to undergo any procedure prior. When we talk about combining surgeries, we just need to make sure that one, time under anesthesia is adequately safe, and 2, that the recovery process will not be overloaded. So I will go over each and every procedure that we could combine with each patient to give them the understanding of what is safe and what may need to be broken up into multiple procedures. So when talking about undergoing a mommy makeover surgery, many patients want to know, do I need to be done with having children first, or should I wait until I'm done having kids? When we talk about this, if we're going to be undergoing a full abdominoplasty where I'm fixing the separation of your muscles, I'm removing excess damaged skin, I will recommend that you are done having children at that point, because if you get pregnant again, the results will basically go back to the baseline prior to having surgery. When we're talking about smaller procedures, mini tummy tuck, liposuction procedure, breast augmentation procedures, you can have these even if you are planning to have kids in the future. However, you always need to understand with weight loss, weight gain, pregnancy, your body will change, so you cannot expect it to continue to look like it did right after surgery. So after a mommy makeover surgery, many parents are concerned, when can I lift up my kids after surgery? Basically, I will give you guidelines for recovery for restrictions. This includes position, weight lifting restrictions, activity restrictions. As long as you're following the restrictions, you can lift your children, but this depends on how heavy they are, how old they are, how much activity it is going to take to lift these kids. So we'll go over each and every one of the restrictions in depth with you so that you understand when it is safe to lift your kids, play with your kids, and interact at a certain level with them following surgery. Many patients want to know, will a mommy makeover surgery help me lose weight, or is this a misconception? When we talk about weight loss, cosmetic plastic surgery procedures are typically not for weight loss. With a mommy makeover, if you undergo a tummy tuck, liposuction, you will lose weight because we are removing tissue. However, this is not a weight loss surgery. You will, however, look as though you've lost weight because you will be more contoured, have more elegant lines. So again, do you lose weight with these procedures? Possibly, but that is not the goal of the procedure. So what I always go over with my patients before surgery is the exact location I expect their scars to be, how wide, how thin, coloration of each individual scar that I will expect with each position of the body, because not all scars heal the same. So understanding, how are they going to be discreet? How am I going to attempt to keep them hidden with regular clothing and or even revealing clothing? You'll understand that prior to undergoing each surgery.